healthcare often treats women as small men, which makes no sense. We are taught to think or to celebrate that VC is the holy grail of how you raise money, and it isn't. I can't believe I'm going through this really hideous experience and I'm having to do the work to find help. Like, this should be coming to me. Why is it that every other woman has a story? This has to stop.
So true.
This has to stop.
Absolutely.
It is absolutely outrageous.
It is.
It's not good enough.
Hi, I'm Kelly Allison.
And I'm Harriet Gisborne.
We're really excited to introduce you to KVA's concept, Health Applied.
So in this episode, we cover so many important conversations about the inequality in women's health.
There's some amazing statistics that actually has been really eye-opening for me that I just didn't know.
Mind-blowing.
Yeah.
And it's the full cycle. It's everything from the investment commercial side to it, to women being included in trials, medicine being for them, and then that misogynistic healthcare system that we've got to break altogether.
Absolutely. And I think talking to Chantal Cox, our guest speaker on today's episode, is absolutely incredible, powerhouse, and her having that HCP background and having been a GP in previous lives has just given her this fountain of knowledge and an understanding. I think it's a deep understanding of then going into venture capitalism, which then has given this unique take on why there is a gender bias for women within healthcare.
Absolutely. So listen to us diving into it and talking about all the solutions that we can do. Also, of course, there will be mentions of pregnancy loss within this episode. So welcome to today's episode where we focus on the gender bias in healthcare. As we know, there's so many challenges that we're going to be diving into, but specifically today, also looking at that challenge and inequality in the funding that goes behind it.
This is going to be such a great conversation. So firstly, to introduce our amazing guest, who is super inspiring, and we're so grateful that you were able to come on the show today. This is Chantal Cox, who is... I'll let you introduce yourself.
I guess the 30-second elevator pitch about me is I am a doctor by background. I worked in the NHS for 3 years before pivoting out, and that was mainly because I guess I just wanted to solve problems at a more macro scale. I was a bit frustrated by the system, and I kind of felt like we were kind of tech laggards, and the people who often had the most negative experience of healthcare were those who were in minority groups, right? So whether that's people who are immigrants, whether it's people who are from lower socioeconomic groups, and actually I'd include women in that because healthcare often treats women as small men, which makes no sense. So I left the NHS for what I thought would be a year, went to McKinsey to be a strategy consultant. Absolutely loved my time there. I did a ton of healthcare and medtech and healthcare systems work, but also consumer and banking and manufacturing, and learned how to solve problems in all the different sectors. I didn't come back to the NHS. Instead, I actually found my love of, I guess, building in healthcare, and decided either I wanted to go and build a healthcare business in the UK, or I wanted to enable it, and effectively that meant invest in it. So I spent the last 3.5 years investing in early stage healthcare companies, and I think of the job that I do as very much a grown-up Dragon's Den.
And you mentioned moving out of the NHS through those frustrations that you saw for the underrepresented groups. Was there a key moment where you felt, oh my gosh, this is broken, something has to change, and I'm going to make it my mission to do that?
I don't know if it was a key moment. It's probably lots of micro moments.
Yeah.
I think I probably knew about 3 years into medical school that I wasn't going to be a medic forever.
Yeah.
I did something called like an intercalated degree, or a sort of sandwich degree in between medicine in bioethics and medical law. And whilst I was doing that, I got to write a lot. So this is when blogging was really a big thing, and Deliciously Ella had come up, and Alice Living, who was called Clean Eating Alice then, those people sort of
from my hometown.
Oh, I didn't know that. Love that.
Yeah, but she really got it at that height. Exactly.
Yeah, exactly. So that was really happening. Instagram was really growing. I started blogging, which was something that was very new then. I got an internship at a GP magazine. I was just writing a lot, and I was like, oh, this is quite fun. There's a way to really democratise access to the information that I have as a medic and put that out in the world. And I thought I wanted to be a TV doctor. Like, that was my plan. But ultimately, I was like, to be a TV doctor, you have to kind of finish studying medicine. And so I went back to medical
technicality.
school. Yeah, kind of necessary. So I did that, and I guess it was then that I was like, oh, I've got an itch. Right?
Yeah.
I'm going to be, if I stay in medicine, I'm going to probably do medicine but also I might leave. And I think I knew that even then, which is quite, but I wouldn't say there was an aha moment where I was like, I'm going to leave. Like I'm fed up and threw my toys out the pram. Like that did not happen. I still see it as the most unbelievably humbling job I've ever done. Wow. And it was the greatest privilege of my life.
That's amazing. And I love your energy and drive to create a positive change. And like this whole conversation being around how like that bias and the inequality for women in healthcare, like some stats that you see diving into that are just mind-blowing. And one that I saw was under 5% of global R&D investment goes on women's health. And of that 5%, 4% of it is on cancers. So that is under 1% of spend going on
everything else.
Everything for women.
Yeah.
That is tiny.
Yeah.
And like through your VC ventures, is that something you saw as well?
The problem with venture capital is the priority is returning on a fund. If you then as a fund want to invest in a business, you need to be able to promise that you will return to those investors.
Yeah.
A lot of the businesses that we see are very much venture backable because they could become 100 million, billion pound companies, right? Yeah. But a lot of them are smaller businesses, which means the capital just doesn't match the business, right? It doesn't mean the business isn't a good business. It's fantastic. But I think there's a real knowledge gap between companies and investors, also should I say founders and investors, where the founders are frustrated that they're not getting the funding and the investors are frustrated that the founders don't get that their company can't be big enough to be venture backable, right? So like, and that it just feels unfair, but it's because we don't know. And I didn't know before I went into venture that that's how it works. I just thought like you came up with an idea and you raised tons of money for it. Because that's what you see in the press, right?
Yeah.
Like,
So true,
like, and that's what we're kind of, and it's glamorized massively. Dragon's Den does it too. To me, and I say this with love, Dragon's Den is about PR. That's why you do that. 100%. That's why you do Dragon's Den. Because you don't want to give away 40% of your business for 25 grand. No one does that, right? But I think we are taught to think or to celebrate that VC is the holy grail of how you raise money. And it isn't. There are so many ways of raising money, and I think you have to think about what you want the outcome to be and how much ownership you want in your business and how much impact you want to have in it versus how much wealth you want to create. And that's more societal, like educational piece. It's not the fault of the funders. A lot of the women's health ideas you see coming through aren't evidence-based either. And so they sit more in like a wellness category, which is absolutely fine, but it's not scientifically rigorous. And for the funds that do get healthcare and do get life sciences, they're like, we can't back this because there's no meta-analysis, there's no randomized control trials, there's nothing there which says that this is real. It could be voodoo medicine for all we know. So we're not going to give you millions to go and launch another supplement brand when we have no evidence that it'll actually work. Like, that's also like bad practice as well. So it's a vicious cycle. Like not enough funding going into research, not enough funding going to the companies, and that means the companies can't get out there and sell to women who actually need help.
We were chatting and you mentioned that in that 3.5 years, you'd never actually put any investment into women-owned businesses, which if there's people listening who have a business that they want to launch, what do you think that solution is in terms of what can people do to actually make a change there? Because if I was hearing that as a stat,
I think,
I would be terrified. I would think there's no point. And even when we've raised before for myself and Harriet, and I would never ever have thought that would be working against us to be women.
So firstly, it makes me really sad that I haven't made a women's health investment. I think I reflect on the reasons why a lot. I think firstly, my remit was what we call seed to Series B, which often means you need to have like already be generating some revenue. And all the way up to maybe generating 5+ million revenue a year. Most of the time, because I talk a lot about women's health very publicly, whether it's on podcasts like this or panels or on LinkedIn or wherever, I did meet a lot of women's health founders, but they were at the idea stage. So I was the wrong person to meet them and give them money. That's basically the reason I couldn't invest in them from a fund perspective. You then would ask, what follows is, why didn't you angel invest in them? And my reason, almost 99 times out of 100, is that I rarely could see a commercial model that worked or that was scalable. I think those founders had a brilliant idea. They were the right... They identified the right problem. It's absolutely the right time. Like, it's a burning platform of women's health. Great story, often a very personal one, but didn't necessarily have the like commercial nous or had solved for it in their team with someone who did have the commercial nous to work out how this thing is actually going to sell. So they'd show you a slide, that was literally like, I'm going to sell to the NHS, I'm going to sell to insurers, and I'm going to sell direct to consumer. And I'm like, cool, that's quite broad.
And you saw that more prominently in the women's health opportunities than anything else.
Yeah, I think so, because I think we're frustrated. Like, I think launching a women's health company often is like our version of bra burning. Like, it's just like, for goodness sake, I'm sick of like having a rubbish experience. Like, I'm just going to solve it myself, which is great. And you can, but like, you do need to work out who pays.
Yeah.
Right? Especially in the UK, where we're used to free healthcare or free at the point of delivery. If you're going to launch something that's direct to consumer, you need to convince someone who is used to receiving free care that they should pay for it.
Yeah.
Like, that's a huge ask. And like, I just didn't hear enough. I didn't hear any of those stories really.
So it's about having more of the commercial planning behind it. Yeah. But then also maybe exploring other options like bank loans, business loans.
Yeah, other ways. And I feel I'm so on the fence about how I feel about that, because so many people say to founders, why don't you go and bootstrap your business first? Like everyone just has hundreds of thousands at home, like sitting in a bank account they can just use and put into their business. Yes, some people do, but those people tend to be from certain socioeconomic groups. They're typically men. They typically have some kind of inheritance or something. And like most of the women I meet, at least in women's health, do not have any of the above. So it's very, very hard. They're also scared of bank loans because they're like, what debt? What am I going to do? Like, I've already got my credit card debt. I'm already paying for my rent. I've got kids at nursery. Where am I going to find? Like, I don't want to take a loan. They see debt as bad. Debt is very good if you have a way of paying it back. Right? It's so not a negative thing. And it also, debt allows you to keep your business. When you raise equity, you give away ownership of what you own. If you raise debt, you keep your business as long as you can pay the debt back. Right? So it's actually a really positive thing. But that stems right the way back to like how we teach girls at school about money. Like, if we don't start to teach women about finances and how we empower ourselves, how on earth are we going to build great businesses? Like, that's where it starts.
And I think it's that inner self-belief as well, isn't it? It's that blind confidence that no, I can do this. And it's so easy to think, oh, okay, I'll just give away some equity or some cash. And we've always said this, your equity is your gold, and it's your equity that you hang on to as much as you can, because it lasts forever, and your whole growth journey of a company is that equity that represents the company itself. So giving that away, you do that once and then it's gone. So any way you can, do it without giving away the equity. But then it comes to, which I think a lot of women have, that insecurity of, okay, am I experienced enough? Am I capable enough? Is my voice accurate or long enough or strong enough? Just knowing that it's a possibility. And I think for some reason, women are often more apologetic and self-conscious of their ability to pay back the debt or to make money, whereas there's so much money out there in the world that I think the difference between someone that can be in an abundance and can have that and can make that money is the ones that truly believe I deserve a share in that and I can just reach out and take it and I can make it happen and I can act on this and I can bring a value. So trying to instill that self-belief in women.
And it is hard. Like, I do think this is way bigger than women's health, like the conversation. I think I remember seeing there's a founder who's a startup founder. She's also been on Dragon's Den and she might have started a business with her sister. She's epic. Her narrative online is incredible. And she posted recently and she said, I have no regrets about starting a business with my sister, but if we had our time again, I probably would have started it with a man, because I would just be more likely to raise money. And I was like, I commented on the post and said, this breaks my heart to read, but I totally get why. Like, I totally get why, because that self-belief comes across in fundraising conversations. It's people often, it's mini-me bias, right? They like to invest in what they know, what they see. So even if your business her business isn't in women's health specifically, but it is related to women, even if your business is unrelated to that person because of their gender, like they are more likely to just get into rooms that you can't get in, to sell things to people you can't sell to, and to raise money from people that you can't raise from, just by virtue of being male.
Being a man,
And it's so unfair, because I'm always so torn when I meet men building women's health businesses and I'm like, why you?
I know, right?
But then I'm also like, if you can raise and the business is great, then cool, like at least it's being built. Like, I don't know what to do about that.
I wonder what role visibility online plays in this. But recently, I don't know if you saw on LinkedIn, but I was doing a bit of an experiment which has kind of been all over the press and kind of publicised and spoken about quite a lot. And it was all about the social media bias of the algorithm. These algorithms are quite often created by men because a lot of the top engineers are men. And obviously the algorithms are being kind of changed by AI and they're self-learning, but they're being created somewhere. And what we've been able to see on LinkedIn is that when you set your profile to be a man and you put a male profile picture, and there's been people who have had a male and a female founder of a company, a very similar amount of followers on LinkedIn. They've both posted exactly the same thing. And you can see, I mean, even over a year ago, this time a year ago, if I posted something on LinkedIn, I would get between 4 to 7 million views of it. Wow. Really good. The same time this year, and I've posted consistently and nothing has changed, it's now around about 1,000. Something has changed in that algorithm. And it's not just to do with personal accounts, it's also business pages. I wonder is there some kind of role there that social media is playing where women's voices are actually, from a business and a women's health perspective, being silenced somewhat?
Yeah, absolutely. Like I did see your efforts on that front and I loved it. I changed my gender and pronouns for a week and was shocked at like how.
Did you get changed?
Did you see a reaction?
Well, it's more that my content was tanking, so I just was curious. But I also was like, I hate the system, so I'm just going to go back to being a woman and fine, let it tank. Like I was just annoyed. But I think you did the right thing. I think the social media companies do have a big, huge part to play. I think there are a lot of great people who are far more experienced and knowledgeable than me on this space, whether it's Cindy Gallup, Deirdre O'Neill, etc. They're amazing, who have been like really fighting the system and challenging it for years on this exact point. And it is so frustrating. But the reality is it's going to affect sales too. Like if you are not able to advertise your product because it's women's health, how do you get to women?
It's that cycle, isn't it?
It's just ridiculous. I mean, one of my like quick solves for it for me would be just the guys who have the distribution agreeing to be allies here and you share the content then, because obviously they don't, you know, whether it's Harry Stebbings, anything he touches turns to gold right now, whether it's Stephen Bartlett, you guys have distribution is access and it's how you are able to sell. Somehow partnering with those guys and saying, look, I don't know why the algorithm hates me, but I've got this great service, right? Why don't you give me, you know, a few posts a week plus 100k of investment and take 2% of my business. It's that's worth it for me because I can't I can't fight LinkedIn. I can't fight Meta. I can't fight these guys. But you're already winning. So save me the pain, like, and just give me my distribution.
Part of me wants that fight though.
Same,
part of me as a woman goes,
I agree.
Let's do it. Let's try. But I know exactly what you're saying.
But it's just time.
I think that's why raising awareness and the visibility and the know-how, because that system at the top is all screwed, that we're trying to, whether it's from investment through to treatment, but then the real world impact that has from diagnosis and quality of life. Like, did you see that in the NHS when you were working there?
I feel like I was too young to really like take note of it. I think it's since leaving medicine and almost having that like outside in perspective that I've really, it blew my mind that I had better designed experiences from the likes of like Amazon or Tesco than I did in healthcare. Like it really blew my mind. And I think that's what spurs me on now. I'm like, it doesn't make sense that everyone has, particularly women, miserable healthcare experiences. And it's not because the people serving them, to be clear, are bad people. It's because the system they operate in is not quite functioning in the way it should, and it's not serving them. But I do think there is a way to delight and to care for, to hear, to listen, to learn, to treat in a way that makes people genuinely feel good. And it shouldn't be an oxymoron, like healthcare and like good care should not be you know, so far apart. And I think things are changing slowly, but they are changing.
You've got to be able to find your voice and stand up for yourself. I think we all know our bodies so much better than any GP, than anyone in secondary care. You could get the best urologist in the world, but if you know your body, then you can really advocate for yourself. Like I had an emergency bowel surgery and I had a blocked bowel. I didn't know what it was. It didn't show up on any scans. And I had this operation. About a year later, I had the exact same pain. I knew what it was and I knew I had about 20 minutes to get to a hospital and I needed to have that operated on immediately before
It was
something would
terrifying.
happen.
Bless you.
And I went to that hospital, and luckily I was in London at the time, and I got a much different level of service than I did from my local hospital, which is Home Counties. But I straight away said to them, I have a blocked bowel. This is exactly where it is. This is the operation you need to do. And they took me into CT and they said, there's no signs of it. And I said, trust me, I know exactly what this is. And you don't have long before my bowel's going to rupture. You need to do this right now. And they said, okay, we're only doing this because your vitals are normal. We're doing this because you're screaming in pain and you're telling us that you need this surgery. Sure enough, they did it, and they got to my bowel just in time before the necrosis would have started.
Wow.
So, and the surgeon shook my hand when I woke up and said, you know, well done, thank you for
Advocating for
pushing.
yourself, yeah.
A lot of people, especially when you're in pain like that, you know, when you're in labour and you need something, you just can't often find that voice.
Yeah. And I think it's so hard, isn't it? Because well done you, by the way, for advocating for yourself and like getting the care that you deserve.
I thought I might die, so I thought I had to.
It's probably a good time to shout that. I think that makes sense.
It was literally on the card, so I was like, this is life
probably
or
a
death.
time, yeah.
Put me in resus now.
Do you know what? You had been in acute pain for maybe a week or so leading up to that, and being like, oh no, it'll pass. Oh no. I think women
I was taking ibuprofen.
deal with
thinking, "Oh, it's
pain
fine,
for
it's
such a
gonna go
long
away."
period of time before they shout up.
Doctors get such a bashing, don't they, for not listening and not knowing. And the reality is they can't look at you and know what's going on with you. So like there is like, I want to defend doctors as well in some way, because like it is hard.
It's really
but
hard.
I am fed up of hearing stories like that.
Yeah.
So like where, I mean, it's nice to hear that you could advocate for yourself, but the majority of people don't.
Yeah.
And I feel like as someone who was fortunate enough to have had like a medical training,
Yeah.
I still find myself in situations where I don't feel like I can fully advocate for myself.
Yeah.
Like, and that blows my mind. I'm like, I'm like perfect use case for
I know,
advocacy.
yeah.
And here's a fun story. So when I was about 25 weeks pregnant, I had really deep, and I'm going to get really personal now,
Love
deep vaginal pain. Like, I can't tell you how much I could feel.
Oh my God, we're
And
both sick. We're like,
and people would like kept saying, oh, it's lightning crotch. I was like, no. Like, this isn't, I don't think this is lightning crotch. Also, like, baby's not big enough yet for that really to be what it is.
Yeah.
But there is something wrong, to the point where like I was waddling, like my husband would roll me out of bed. I'd stand up, and then after a few minutes it would dissipate. And I luckily had my like the midwife appointment.
Midwife, yeah.
And I think because I was waddling, the midwife was like, look, I think there's a consultant around, like maybe just see them, because there's clearly something wrong. And I was like, there is. Help me. Literally. I saw the consultant. He did an examination, which I was fine with. I consented to. That's all good. And then he was like, well, I can't see anything wrong. I think you need to have an STI test. And I was like, a what? And he was like, I think you need to go for a full panel of STI tests.
Wow.
He was like, you ever had herpes? You ever had whatever? And I was like, look, no shade on anyone who has, but I'm pretty sure I don't have an STI. And he was like, I'm sending you for STI tests.
Wow.
So I'm there like 25, 26 weeks pregnant, now waddling to an STI clinic, sitting there for hours to get swabbed for whatever else. And then everything came back negative, which I knew it would.
Yeah.
And I thought, I've come in here, a pregnant woman, like, yes, I'd had losses before, so it wasn't my first pregnancy, but it's the furthest I'd ever got. I'd sought help, I'd sought advice. I told you that that wasn't what was going on here. And you didn't, you just, whatever your biases decided that I must have a sexually transmitted infection, and that must be why I've got vaginal pain. I then did a ton of research, as you do when you are, I think, empowered somewhat.
Yeah.
Saw a private physio, women's health physio locally, who bothered to scan me and bothered to spent 45 minutes with me and was like, no, this is just an atypical like presentation of like pubic symphysis pain or whatever, like, which is very normal for women. It's just mine happened to present much lower down.
Yeah.
She was like, it's really actually quite common. And I was like, whoa. So I spent like 3 hours in an STI, like a sexual health clinic.
That is crazy.
Like, and really I just needed some pain relief and some exercises to help me. And I should have defended myself more. I honestly, even now, I really regret not standing up to that clinician. But I just trusted him, even though I knew. I was like, I have no other sexual partners. My partner has no other sexual partners. Like, where would I have gotten an STI from?
It's just how we're conditioned, though. It's the way that we evolve to know what's normal. And like, even not growing up with a gynecologist. And you were saying that in France, as soon as you hit having your period between 10 and 18, you then have your first gynecologist appointment, and everyone says, who's your gyno, like in America, and like not having that here, we're just absolutely conditioned that, okay, our body goes through these huge changes. We all of a sudden start having a period. We then have babies, then go through the menopause.
Yeah.
And all throughout this journey, we don't have a designated specialist to support with that. And I think because of that, we become conditioned to just accept anything that happens to us and not question it. And
so
you know,
true.
as 50% of the population, we go through all these changes and even childbirth and after childbirth and your body changes more than ever, and you have to self-investigate and self-promote having any support through that.
Which is really not okay.
It's wild,
like,
isn't
especially
it?
when you're going through a tough time, that is not when you have to then start figuring out how to advocate for
Yeah.
yourself.
Exactly.
And I think that's the bit that I find like really quite astonishing. So on my first pregnancy, I was very fortunate, we got pregnant very quickly, but sadly I didn't have my first sort of dating scan till too late. So when I got to the scan, they told us that there were problems with the baby and it wasn't viable.
So sorry.
And I remember walking out of that room and like wailing, and they ushered my husband and I into a room, and we're both sobbing, and it's all very traumatic. And then they call me, they say, go home and then we'll talk about the next steps. And the hospital were lovely, but they called me and they said, look, Chantal, we don't have any space to surgically operate on you for 3 weeks. By this point, I'm already like 14 and a half weeks pregnant.
Yeah.
I knew that by 17, 18 weeks, I might be feeling like fetal movement. So I was like, I'm quite nervous about this. Like, please, can we make sure we can do something to help me? They said, it's fine. You can come in tomorrow and we can start the process, which you can kind of get what I'm getting at here. But you'll have to labour on the labour ward, where there'll be women who have like live births. And I was like, and my mum, who's a midwife, was like, absolutely not, that is traumatic.
Yeah.
So I ended up phoning round Mary Stopes and all these other like charities that can help. And then eventually paying for like care on Harley Street, which I was fortunate to be able to do because I had some savings and my husband and I had savings. But I remember thinking like, oh my goodness, I can't believe I'm going through this really hideous experience and I'm having to do the work to find help. Like, this should be coming to me. And then I remember like a week later, a girlfriend calling me who just had a baby to check in, and her baby started crying in the background and my boob started leaking. And no one had warned me that might happen. So I was just looking down being like, oh my God, I'm literally dripping. Like, what is happening? But there was no one to call. And then 2 weeks later, the hospital called me and they're like, where are you? You're supposed to be at your 20-week appointment. And I was like, what? Like, what is happening? And I just think, and then when I've told those stories, women come back at you with way worse. Why is it that every other woman has a story? This has to stop.
So true.
This has to stop. It is absolutely outrageous.
It is.
It's not good enough and we don't deserve it. And we're out here and we are advocating for ourselves. We are researching, we are investing, we are building. It's still not good enough. Like, it's time. It's time.
Thank you for sharing that. It makes me
thank you.
like well up, because a similar, very, very similar, almost mirror image situation happened to me. And how crazy that it's so common when you start talking about it. And when like we thought everything was fine going through the pregnancy, similar time, I had the scan and they confirmed it wasn't viable. I didn't even understand what that really meant at the time. I was like, okay, well, if you have a miscarriage, that happens early on. And whereas it was a missed miscarriage, which I'd never heard of before, and just meant that the pregnancy wasn't viable, but my body didn't know that and was continuing to try and grow the baby. And a very, very similar situation that the NHS said that from a timing point of view, they wanted me to wait even though they confirmed it wasn't viable, to do their tick boxes so nothing came back on them. They wanted me to wait, I think, a month until the next scan to confirm. And I remember not being able to get my words out, saying, okay, or it's choking me up, does this mean there's hope? Like, if you're making me wait, does that mean that what you're saying might not be the case? They're like, no, as a human, we have to tell you it is the case. But from a legal and protection point of view, we need to confirm in a month's time. And it's just, and I remember talking to Kelly a lot through it. And Kelly is so powerful and advocate for yourself and such a champion. And I was just a crumble at this point. And Kelly really encouraged me to keep pushing for myself and keep calling and saying, no, I can't wait another month. Like a similar thing with getting to that later stage. It makes it more and more traumatic. And then ended up giving up on the NHS as well and going private. And luckily, so we have private medical through the company, and didn't even think that it would be covered because you automatically know anything pregnancy related as a woman isn't covered by your private healthcare because, you know, that's an inconvenience and they're a business that wants to make money. However, luckily it was. And then I felt so grateful in that moment, was able to go private, and within 2-3 days had the surgery to remove the baby. But a similar thing, I had a call 2 weeks to a month later saying, where are you at your scan appointment? And I was like, why aren't your systems linked up?
Honestly.
And I had to explain, crying to the guy down the phone, why? Why are you now chasing me for not?
And also, like, you can be really brutal. Well, firstly, thank you for sharing.
Thank you for sharing
as well. I think the more we talk about it,
you have to.
Help.
But I do remember thinking in the moment, like, one day I will share this story. Like, one day I'll be able to do this so that this wasn't in vain. But I think what it's made me do, it's almost galvanized me in that I'm like, I don't actually blame anyone. Like, I'm not angry.
No.
But I don't think it's good enough that I had to look after myself in that situation. I think everyone should have looked after me. That's what I think should have happened there. And that's where I think we are failing women. We are waiting for them to have something go wrong. We are waiting for them to be in such excruciating pain, such crippling pain, to almost give up before we say, okay, like, let's, you know, wrap them in cotton wool. That's not good enough. We're a very different generation. We want to live healthy, long, optimal lives. Like, we can do, you know, longevity tests till the beginning of time, but the reality is, like, periods are almost universally experienced by all women. So we should be looking after women with their periods and everything else around their hormones from day dot. Like, when you were born with all the eggs you will ever have in your life. That is incredible. So we should do something about that.
Absolutely.
And also, isn't there something that when a baby grows in your stomach, they are growing the eggs that they will have. So when you're pregnant, you are growing that baby's eggs. So you as an egg grew in your grandmother's stomach.
That's crazy.
Isn't that incredible?
Mind-blowing.
Women's bodies. Oh, I'm in such awe of women's bodies. We are unbelievable.
We are.
Unbelievable.
Even through, like, labour, when you feel yourself, obviously so many different types of labour and experiences, but from having a vaginal birth, which I was terrified about, absolutely terrified. The amount of research I did around ripping, was my biggest fear in the world. I thought the world would end if I ripped. However, going through, and everyone said, like my mum said leading up to it, you don't feel it. You're not even aware of it. And I'm like, on what planet are you not aware where you are ripping from your vagina through to your bum? Like, how is that not a terrifying thing? But honestly, when you're in that space, you are so animalistic and you are so built for it that your body just takes over. And I was so proud to be a woman.
Out of curiosity, what made you so worried about tearing? Was it your antenatal class?
No, I was really bad. I did antenatal classes. I found them so boring. I went to 1.5. The thing that scared me was just the thought of it.
There is something powerful about the concept of a doula, right? So they've shown that the doulas positively impact the reduction in emergency C-section rates. Less pain relief required, less analgesia required during labour, and something else. Can't remember.
In case anyone doesn't know what a doula is.
Okay, so they're like a non-medical professional. People think that they're midwives, but they're not. They're just people who've done like a couple of days course in like how to care for a woman around before they have a baby, during labour, and then sometimes afterwards. And they cost quite a lot. Something you pay for privately. But they're effectively an advocate for you in that peripartum world. They cost a lot, but the outcomes are really interesting and they're really positive. There's a really great book called Expecting Better by Emily Oster. I would get it for every one of my friends whenever they get pregnant, just as like, and it's split into 3 different, sections. One is first trimester, second trimester, third. And it's written by someone who's a health economist. So she's not medical, but she just likes to understand data. And so she understood what it meant, like how to get pregnant, what it meant when she was pregnant, whether she could drink or eat sushi and stuff. And she speaks a lot about doulas and how powerful they are for childbirth. They're not available in the NHS. It's not at all. So I wonder if there's something where you can use sort of health adjacent people to support better.
Yeah.
Just so that women feel like they've got someone who's very consistent and who they know.
Yeah.
A bit like you hear some people in their NHS trust where they see the same midwife every time they have an appointment. I'm like, I did not.
No.
But if I did, that would have been really nice. And then if you've seen the same person at birth who's known you all that time, imagine how much more relaxed you'd be. Not easy to like implement, I get.
No.
But wow, that's great care.
Absolutely. Yeah. You shouldn't have to pay for that, I don't think.
No, but it's hard to figure out when there's not enough
is.
midwives, right?
Absolutely.
Yeah.
And even letting you know the options.
Yeah.
Like I remember not planning it at all because I'm a control freak, and I thought if I give myself a birthing plan, medicine does not often go to plan, I will then freak out. So I didn't even visit the hospital before. I also decided to move house a week and a half before I gave birth. So you know, my hormones were like, Harriet, you need to buy a house in your hometown. You need to move there. My partner was away in Wales for work. I was like, you know, this is working out perfectly. So didn't even visit the hospital, and luck was on my side that I didn't know about birthing, like midwife-led birthing centres. I didn't know about ward births in comparison to whatever. I didn't know any of that stuff because I was winging it. And when I got there, I walked into the hospital on the, is it the midwife birthing centre? Is that what it's called? Midwife-led birthing centre. Unintentionally, that's where I walked in. And they gave me a room and I was like, oh my gosh, this is incredible.
It's so nice.
There is, there is. And it was just NHS local hospital. But I had my own ensuite. I had my own light projector to give me ambient lighting on the ceiling. And I was like, this is a bit of me. I can do this. And then they said, well, do you have a birthing plan? And I was like, no, but, you know, not up for the struggle. So considering an epidural. But, oh, we need to go upstairs, the epidural. That's the ward. And you'll need to be on the ward. And I was like, oh, well, I really quite like this ensuite in this room. Like, can I have this upstairs? Like, no, this is just down here. So it's totally unplanned. But oh my gosh, it was incredible because there's so much science behind being in an environment that's less clinical and the endorphins and the happy hormones that gives you rather than adrenaline, which then creates fight and flight and can slow down labour and make it more painful. And that I hit the lucky jackpot on falling into that situation and it working really well for me. But I feel like a doula, they are the exact person that would talk you through that and the options and the benefits.
Your antenatal class would have done that too.
If I turned up.
But I agree. But I guess like I feel on the fence about antenatal classes. I think they do educate a lot. And you're right, there is Google. The reason I struggled with it partly was because I'm medical by background. But also, I just think they were too pro-vaginal births. And that really bothered me. So I was like, I had also no plan. But I was like, I don't know, I might end up having an emergency C-section. Or there might be women, I don't know any of these other 10 women. Antenatal classes are a bit like going to Alcoholics Anonymous, but because you're all pregnant, it's really strange. But I was like, we don't know how all these women want to birth their babies, right, at all. And we're just pushing this agenda. And I just really didn't like that. I kept getting to the car with my husband every Monday night. Also, it was always at 8 p.m. when we're all freaking tired. I'm like, I'm pregnant and it's so hot in here. And I'd get in the car and be like, what if half of us want to have C-sections and we just aren't covering any of that? Like, why are we're not glamorizing, but we're kind of making it look like it's better to have this kind of birth. But it's not. And I just said to my husband, like, my only plan is healthy me, healthy baby. Like, as long as I come out alive. And I genuinely meant that because I knew the stats around black women in childbirth. Like, I'm 5 times more likely to die in childbirth than
stop.
So I was like, I need to come out alive and I need our baby to come out alive. And if those two things happen, you can put me in theatre, it can come out the sunroof, it can come out my vag. I don't care which one, as long as both of us are okay.
5 times more likely. That has absolutely taken my breath away.
Are wild. I remember even thinking it during labour.
Stop.
I remember thinking during labour, I think I had a 31-hour labour, so it was long. But I remember thinking at like hour 18 or something and turning to him, and I was so tearful just because I think I was tired. And just being like, my baby had turned back to back. I didn't know, which is why I was in so much pain, but I didn't know at the time. And I turned to him and was just like, please don't let me be a statistic. I said those words to him, and I think that broke his heart. He was just like, I walked out and I sobbed because I didn't know how to help because I couldn't get the baby out for you. But like, I just cared about those two things. And I still maintain to this day, if I have another baby, if I'm lucky enough to have another baby, I will go in with the same attitude. I really don't care what route they come out, like as long as that we're both well. And I think that's more of a better agenda to push than like it's the same with breastfeeding. We shouldn't be pushing certain things on women. It's whatever works for you. We don't know what history, what context, what trauma women come with. Like, their choices are their choices. Like, it doesn't really matter.
I remember I was trying to breastfeed. I thought I had to do it because my mum had done it, my nan had done it. It's what is in all the books. And I was there, obviously, Sienna was in intensive care. She was on a ventilator. I wasn't allowed to touch her for the first 2 weeks of her life. And there was one time where I touched her and her SATs just, the machine was going crazy and they said, please don't touch your baby. And I was like, okay. So when I did finally hold her 2 weeks in, I just gave it to my husband and I said, I don't feel like she's mine. I don't have any, I don't know what to do with this situation. It was so wild. But with breastfeeding, I was desperately, I had the pump there. I was obviously recovering from the emergency section. I had my baby who I was being told 50% chance of living. And I was still trying to get this milk out. No one ever said to me at any point, actually, you're not going to get that milk free flowing because you're not having contact with your baby. So you're not going to be, your hormones are not going to be producing the milk in the same way. And I was sat there trying for hours and I'd get a tiny bit out and I'd put it in the fridge and I'd say to them, when you tube feed her, can you give her this and then top it up with formula? And it was only about, I don't know, maybe 3 or 4 weeks in that one of the nurses said to me, you know, you don't have to do that. We're mainly giving a formula. You're getting barely anything out and it's traumatic. And I was like, oh, okay. And then when I had my second daughter, I was like, I'm not breastfeeding. That's not for me. And, you know, for some people, they love it and they have a great experience, but everyone is so different. Yeah. And it's just, I wish that I'd had that knowledge and someone had told me, because I was the only one in my NCT group who didn't take their baby home from hospital. They don't talk about, but it's actually so normal. Like quite a few of my friends have had babies that not have been as sick as Sienna, but have stayed in. And no one spoke about, they all talk about the fast car journey home. It's sort of, you often hear earlier on when John was talking about it, it's such a prominent memory. Whereas for me, I'm like, everyone in my group has taken their babies home and my baby's like on a ventilator. But I just wish there was that awareness piece. And I think that comes into the antenatal care. Like a doula for me would have been amazing in that situation. But back then I just wouldn't have had the money to be able to do that.
Yeah. I guess this comes down to, is the NHS fixable, or is there a bolder,
how long have we got?
Is there a bolder change needed? Because obviously pregnancy and pre and post baby, like, it's such a pivotal time, but also wider than that, like especially as women and being underrepresented in that space. Is it fixable? Do we think it'll be around for much longer?
I do think there's going to have to be more room for other alternative models of healthcare delivery beyond the NHS. And that isn't me being like politically like trying to be very diplomatic at all, but I think the reality is people are already demanding it. So
absolutely.
there's a reason why we have medical grade skincare that's endorsed by clinicians now, right? There's a reason why lots of people are choosing to pay for private medical insurance or are pushing their employers to offer that, so that when they, I don't know, break an arm, they can go through that route to have surgery. I think it's because, particularly in a post-COVID world, they realise the system just isn't always working as well as they'd like it to. And so they need to find alternative ways to get the care that they deserve. For me, I think as it pertains to women's health, I think if you look at like the average 28 to 44-year-old in London, they're already spending the best part of $6,000 a year on health and wellness, right? Wow. So whether that's like gyms, Botox, Sephora, Space NK, the works. I'd actually include childcare and things in that as well, because that's a big part of our spend as women. They're spending the money. Like they'll spend on healthcare too if it'll mean that they can live more enriched lives, right? And I think that is the way healthcare is going to go, because we don't want to keep annoying a GP who can't help us. And we'd rather speed up our endometriosis diagnosis by 6 years, 7 years, than like continue knocking on doors that aren't open for us. So we'll find ways to empower ourselves. It's not fair that we should have to pay. It's not fair that we have to pay for insurance or pay directly, but I think we'll do it. Because we've had enough.
That's so true.
Thank you so much for the chat. Like your knowledge, your passion, your efforts in the space, they're admirable. Thank you.
You too. Thank you.
Wonderful.
It's lovely to see you.
Thank you so much for listening.
If you loved today's episode, please do like, share and follow us on social media.
If you have any comments or questions or want to get involved in any way, please DM us at Health Applied Podcast or drop us a message at hello@healthapplied.co.uk.
Thank you.